Sweet potato.
A sweet potato, just plain old sweet potato. Any butter or salt or anything?
No, I put butter and onions and garlic um, and paprika, salt, and spice it.
Oh, very nice. That sounds good. I don't know if I've had a sweet potato for breakfast before. Just
My kids would always say, "I don't like breakfast food." I'm like,
yeah.
well, what do you want? And they say, well, how about steak and potatoes? I'm like, okay, fine. So, so,
I have had
so we
steak and eggs. Yeah, that's good.
so yesterday for breakfast we had turkey soup. Um, you
Wow.
know, and, yeah,
Leftover turkey from Thanksgiving, I presume.
exactly. I took the whole carcass of the turkey, put it in a pot, and boiled it for a few days. Made a bone broth out of it,
Ah,
and it made a really good soup.
very good. Yeah, so bone broth. Well, welcome everyone as you're joining here. Scott and I are just chatting a little bit, catching up on Thanksgiving, and hope you guys all had a wonderful Thanksgiving. And I did not cook a turkey this year. It was actually so our son. Well, we have four boys, and our second oldest son, Cedric, and the two younger ones stayed home while Amanda and I and our oldest went up to visit someone in the hospital. And so Cedric, our second child, said, "Don't worry, Mom and Dad, I'll cook the turkey." And we're both like, "Oh no, what's going to happen here?" and amazingly, he did a great job. We had a fantastic Thanksgiving dinner, and it was really good. So we came home, cooked up the potatoes and stuffing and cranberries and veggies and pies. It was good stuff. So a good time. All right. Well, so good morning, good afternoon, good evening, whatever time you're watching this. We're live here this morning. Today, Dr. Saunders and I'm Joe Barton, your host, and we are going to be talking about supplements. And we just got done with a big Black Friday sale and a Cyber Monday sale. So we had a lot of people that took us up on some big discounts. We don't have those discounts today. However, I do want to give an incentive to anybody on the call right now today. If they are brave enough to join us on video and just to be interviewed and say hello, I'm going to give away 2 bottles of any of these supplements right here. You can see our extra guests here are joining us: turmeric BP, healthy gut support, Synachroma, and Nervala. So if you would like to join us on video today, I'm going to send you 2 bottles for free as a thank you for joining us. So I'll say that again later. But if you're interested in doing that, just say something in the chat, and Leslie, our co-host behind the scenes, will let me know about that. So yeah. All right. So Scott, let me get my document here. I got to do a quick disclaimer for legal purposes, just so nobody does anything and tries to blame us for it that would get us into trouble. So, or to do anything. Yeah. So, all right. The video content has been made available for informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen here. And Scott, you always have a nice follow-up to another reason why we say that.
Well, yeah, it's you think of it for legal purposes. I think of it for medical purposes. It's important that you individualize everything we talk about. So we talk about things on a general basis, and each person has their own individual case, their own individual causes of illness, for example. And so that's why you have to work individually with your doctor and say, okay, your doctor can say, well, this wouldn't apply to you because you have this problem. And so make sure it applies properly.
Excellent. Yes. Okay. Very good. So it looks like we have a couple people that volunteered to hop on with us here. Pam, that would be awesome. We'd love to talk to you and see you again. So thank you. And Amy, it looks like you raised your hand. I'm not sure if that meant you wanted to join us on video later as well. Just let us know in the chat. So, but before we do that, we'll probably do that in 10 or 15 minutes or so. So let's talk about, let me see, where are my notes? Here we go. Yeah, also in the chat there on Zoom, you can just let us know where you're calling in from. And we've got someone in Florida. I'm jealous. I'm here in South Dakota, and it's, I don't know, what is it? 32 degrees out. It's actually not too bad today. Yesterday it was like 10. Skip in New Braunfels. Good to see you, Skip. And Leslie in South Dakota, my neighbor. I've got my neighbor shirt on today. We went and saw the Mr. Rogers movie on Friday, and it was fantastic. Tom Hanks did a great job. It was really good. It was like a uniquely done type of movie. So I highly recommend it. So won't you be my neighbor? I won't sing for you. Don't worry. Hey, Cheryl in Florida. Good to see you. Cheryl is our team member who helps with customer support and home cares at work. She is awesome, and I don't know what we'd do without you. So thank you, Cheryl. Okay, so let's get into talking about supplements and how it connects to type 2 diabetes specifically. Dr. Saunders, you have a unique view of supplements. I think it'd be great to get into that a little bit today. So why don't you talk to us about why we need supplements, or why should we take supplements?
Okay, so ideally, and everybody says this, and everybody knows it, and ideally you should never take supplements, that all of your nutrition should come from your food. Well, you know, before we knew about vitamins, before we knew about nutrients, before we understood that some things you just have to have, there are some types of fatty acids that you just have to have, there are some types of minerals you just have to have, and if you don't have them, then things don't work right. The body has an amazing ability to work around problems. So if you have scurvy, for example, and you don't have any vitamin C, you could go for years without vitamin C, and your body will work around to some extent. It's like you make something called uric acid, which takes the place of the antioxidant effect of vitamin C. But there are certain functions of vitamin C, like making collagen fibers, that cannot be replaced by anything else. So eventually your collagen's going to break down, and that's really where scurvy, where the sailors that had to be thrown overboard, they died from scurvy. They would bleed to death. Their blood vessels would rupture because their connective tissue just is not holding together anymore because of the lack of vitamin C. So before we knew about all these nutrients, deficiency diseases were common, and these were the things doctors dealt with all the time. Every doctor knew what scurvy was. Every doctor knew what pellagra was, and beriberi, and rickets, and everybody saw cases of them. These weren't something that were rare, but I've never seen a severe case of rickets or scurvy or beriberi, pellagra. I've seen mild cases of malnutrition because people have short gut. For example, they've had surgery and had part of their small intestine removed. So I've seen like mild cases, but this isn't something that we deal with all the time anymore. Partly because we have a greater variety of food. In former times, you didn't have access to all of the food. You know, you couldn't get a watermelon in the middle of a winter. You had like something would come ripe. You know, the apples are ripe from August through October, November, and then they're done for the rest of the year. You have nothing. You have nothing that has any vitamin C in it until the next year when the apples come ripe on the tree again. That's the way life was. And because of that, there was a lot of deficiency disease that was very common. Today, however, because we have all this variety, we don't see it very much, and we see some. So why would you ever take supplements? Well, we have issues with in some cases, our soils are insufficient. So especially for diabetes. So specifically for diabetes, I have done thousands of tests or tests on thousands of people. And I find a majority of them, I don't have a specific number, but definitely a large majority are deficient in chromium and vanadium. These are two minerals, two trace minerals that we absolutely need to use sugar properly. And if you don't have them, then you just don't use sugar properly. And your body can work around it for a while, but eventually you get problems like, especially if you eat sugar, you get problems like insulin resistance and diabetes and metabolic syndrome. And in fact, there was a study done on selenium. The Arizona Cancer Study, they were using selenium. And what was really interesting about that is the people that took selenium had an increase to 12% increased risk of diabetes. And you go, what? Does selenium cause diabetes? It's like, no, selenium does not cause diabetes. But if you are marginal on your chromium and you're taking selenium every day, you inhibit your body's ability to absorb chromium. And all of a sudden that puts you over the edge. And now you have diabetes because you don't have enough chromium. So we have to be careful with our vitamins. It's not just like, oh, everybody needs it, you should take it all the time. The concept of one-a-day vitamins was a marketing idea and has nothing to do with health. We need our nutrients. We need a lot of it for occasional periods of time. So people who tell me, I'm not really good at taking my vitamins. And I always tell them, good, then you are good at taking your vitamins. Because if you're taking them once a week or a couple times a week or every other day, then you're doing great. Because it's the people that take them every day that inhibit other nutrients from being absorbed and cause problems from an oversupply, even toxic supply in some cases, of vitamins. Selenium is actually very toxic, and yet hardly anybody has enough of it because it's not in our soils and the plants don't need it. But then people go, oh my gosh, I need selenium, and they start taking a whole bunch of it every day, and they become toxic. So there's two issues. One is, if you have diabetes, you probably need chromium and vanadium. And number two is, if you're taking a vitamin every single day for long periods of time, then this is generally for years, then you're probably going to inhibit your body's ability to absorb other nutrients.
Yeah. So very interesting. So Cinechroma, for example, has the selenium and the chromium, along with vitamin D, vitamin K2, and vanadium and cinnamon bark extract. So in that case, which a lot of our viewers and subscribers are taking Cinechroma, now could this be taken like once a week, or what would be like the ideal frequency or timing of taking something like Cinechroma?
So people who have diabetes should be taking it every day for at least 90 days, so somewhere around there. So it's a daily thing for at least a few months. And I usually give it to people until their blood sugars come down to normal. And then every other day to twice a week would be good. And that would keep them adequately stocked in those nutrients.
Okay.
To not have to take them every day.
Okay. All right. So can you just talk a little bit about like how are supplements made? We toured our manufacturing facility in Utah a couple months ago when we were together, but could you tell people like maybe clarify some myths that people might think about supplements, like where they come from, how they're made?
Oh, good. Okay. So it really depends on the nutrient. Some nutrients, in fact, most nutrients, when you get a supplement, it's an isolated nutrient from food. So you look at your vitamins as food. And that's really what it is, because it's an extractive food. Like anything else, if you look at white sugar, for example, it's just an extract from sugar cane or sugar beets. And they take out that one chemical called sucrose and isolate it and go, okay, this is sugar. And that's the same thing that the nutrients are on the other side, because in reality, sugar is a nutrient. We use that for energy, right? And we just get too much of it. And that can happen, with your vitamins too. So most of the vitamins that at least that we were looking at are extracts from food. In some cases, they're made, and it depends on what it is. Vitamin, some of the B vitamins are made from actually coal extracts, and vitamin D usually comes from sheep's lanolin, has the dihydrocholesterol, and so they take that and they spread out and expose it to the sun. Well, now they use ultraviolet lights, but they used to expose it to the sun, and then take the vitamin D extract out and make that. So it depends on how that nutrient is normally made, and sometimes if they can take a molecule that is similar and then change it biochemically, then that's sometimes what it does. And sometimes that's a problem, like with vitamin E. If you don't get a natural extract of vitamin E, then you're generally getting a single molecule that's two different types. It's kind of like your left hand and your right hand aren't exactly the same. And that's what happens when, you can put them together this way, but you really, they don't fit over each other in the same way. They're actually opposites. And that's the way molecules are. They have that. So with vitamin E, you have D and a D form and an L form. The D form works, the L form does not work. So if you make it chemically, then you are getting half D and half L, and the L can inhibit the D and actually cause problems. So a lot of research that's done on vitamin E, they say, oh, vitamin E is bad for heart disease, and it's not bad for vitamin E is not bad for heart disease. It's that L form that they're giving to people that blocks the D form, so that vitamin E doesn't work if you have the DL form. So in nature, if you get a natural form of vitamin E, a natural extract, like when you eat almonds, you're getting vitamin E, but there's no L form at all. It's all D. So depending on where it comes from, it's kind of important to know. Most often, I would say a natural natural extract is better, and the less processing, the better.
Okay.
As a rule.
All right. So Pam, if you are ready to take us up on our offer, we'd love to have you join us on video here. Leslie, if you can make that happen. And for anyone else watching, today's offer is if you will join us by video and hop on just for a minute, say hello, and ask a question, or let us ask you a couple questions. I'm going to send you a couple free bottles of two of our supplements, whatever you'd like, whether it's Cinechroma, Nervala, Healthy Gut Support, or Turmeric BP for inflammation. So it looks like Pam is on here. I don't see video yet. So if you can enable your camera.
I don't know how to do that.
Oh, usually in the bottom left of the Zoom, there's a mute button, and then next to it is a video.
Got it.
There we go. Hey, all right.
Hello.
Welcome. Thanks for joining us. Hey, this is our second time on video. So we did an interview together, a couple months ago now, I believe.
Yeah.
Yeah, and that was fantastic. Our whole team loved to watch that over again and learn some stuff. So great to have you here. Where are you calling in from today?
I'm in South Carolina.
South Carolina. How's the weather there?
Actually, believe it or not, it was 29 degrees this morning. I was pretty surprised.
Yeah, that's like South Dakota weather.
Yeah, we haven't got any snow though.
Yeah, we have a little bit. We have ice. It's not going away. Uh,
Cool.
well, so you had asked a question on the chat. So if you want to go ahead and ask that to Dr. Saunders.
Yeah, sure. I had actually asked a question about iron supplements. So I was told that I tend a little on the anemic side and to take an iron supplement. And so I always wondered, what's the best form of that? So I was doing a multivitamin that you were just saying is probably not my best choice, that had iron in it, and wondered if I should do I've seen a liquid iron. I'm told the iron pills aren't so effective, but I could be wrong. Wondered what your thoughts were.
Okay, thanks. Actually, iron is really complex because iron is essential for a lot of functions of the body, including how every cell makes energy requires iron. Plus, we use iron to get oxygen from our lungs into all of the rest of the cells of our body. So it's really, really important. And on the other hand, iron is really bad. It's an irritant. It causes oxidation. It causes inflammation. You don't want too much iron. So we're always in that balancing stage of do we have too much iron or not enough iron? And so if you have been tested and you don't have enough iron, then you can supplement a lot of different irons as long as it's the ferrous form. There's the ferric form, which is the rust, essentially, is really poorly absorbed and not very well used. The ferrous form, there's a simple way to do it that you'll always get enough iron, and that is to take a 16 penny nail. And that's the kind of nails that you use to build a house. Those big nails, and not the ones that are coated. So often they're coated with plastic or zinc coated. Not those, just the regular iron nails, 16 penny nails, and sand off all the coating on it, or use steel wool or something, clean it off, and then wash it and stick it into an orange or a grapefruit or a lemon, a citrus fruit. And what that makes is the ferrous citrate, and you just leave the nail in the orange overnight, and then the next day you pull the nail out and put it into another orange and eat that orange. And if you wait for a couple of days, that's fine. It'll make a black mark in the orange. It'll make it kind of taste funny, have the metallic taste. But that form of iron is ferrous citrate, and it is really easily absorbed. Plus, there's another benefit, and that is that in order to absorb iron, you need vitamin C. Absolutely need it. In fact, you're better off, if you're low in iron, you're better off taking vitamin C than you are taking iron, because you'll absorb it better. Whereas iron can cause irritation. Those pills can cause irritation in the stomach, cause ulcers. Some people get constipated with it. Because it's like I said, it's an irritant. But if you put the nail in the orange, you're getting just the right amount. You're getting ferrous citrate, which is an excellent form. You're getting vitamin C and bioflavonoids with it. So that complex will really help your iron to improve better than anything else.
Wow. Awesome. Thanks.
And it's cheap and easy. You just put the nail in the orange. That's all.
Orange has a lot of sugar. That's okay.
Yes. Well, see, you're doing this for therapeutic reasons. You're not doing it it's not a dietary thing. It's really therapy.
Cool.
And how do you know how much to have then with the orange and the nail? And how often would you do that?
Well, you could, if you're really low in iron, you can do that every day for a few weeks, a few months, depending on your level of iron. I've had people who are super low in iron within 1 month come up to a fairly normal level. So the way I do it is I measure, I test, and I look at their iron stores and their ferritin stores and make sure that they're not getting too much.
Very interesting. Cool. Pam, would you be willing to just give a short little 1-minute recap of your story and testimonial of how things are going for you and how you've been able to work with us and see some improvement?
Yeah, absolutely. I started with the diabetes reversal kit in February. Um, I was looking to get my blood sugar. That was my primary goal. A magnificent side effect is I've lost over 50 pounds,
Wow.
and that's wonderful. I am not fully off the metformin, so for a while I was taking insulin. Got off the insulin within 2 weeks. Um, off I'm off of every other medication except for the metformin, which I'm hopeful to be off soon. Working on that. And but I'm feeling better. My doctor is thrilled. We're working together really well. And so I will try this iron. That's fantastic. But
Yeah.
I just recently started doing the Nervella. I wasn't having any neuropathy symptoms, so I thought, oh, that's not for me. But the other thing that I've stopped doing was taking like Tylenol or Advil or anything like that, because I really want to get away from the pharmaceutical type medication. So from that perspective, I can tell you that Nervala, if I worked really hard raking, or I was uncomfortable from sleeping funny or whatever, Nervala is wonderful. I love it. So real glad I got myself a bottle of that. That's really good stuff. But I've appreciated the products a lot. Cinechroma has helped my blood sugar normalize a lot. Obviously, that, and combined with me dropping carbs down and making a lot of healthier choices. But I did notice a difference with the Cinechroma, and I have appreciated that as well. These weekly webinars have meant so much to me, because it helps me stay on track. It's almost like an accountability. It's like going to a meeting. And even our Facebook group, I enjoy it very much. This has been very life-giving to me.
Hmm. Oh, that's great. Great to hear. Yeah, that's why we do this. We want to help people and keep people on track and clarify information, answer questions. So yeah, thanks for sharing that, Pam. That's awesome. So you had mentioned Nervala. I'll just show a little screenshot of that. So Scott, while we're talking about supplements, and Pam, thank you so much. We're gonna get Skip on here next. So. But thanks for sharing. So Scott, while we load up Skip next, could you talk about Nervala and why this would help in like pain relief, or like she mentioned, raking leaves and being sore afterwards? Something like Nervala would be helpful for that?
Yes. Okay. So Nervala contains alpha lipoic acid, which is a very important antioxidant. A lot of the reactions that people have in diabetes is due to inflammation, and alpha lipoic acid is really important for getting rid of inflammation. And the other part that Pam mentioned was energy. In order for the nerves to make energy, the mitochondria, which are the little bacteria inside the cells that make the energy for the cell, they have to be able to get rid of the inflammation so that they can function really well. And there's two things. The alpha lipoic acid is important, and the benfotiamine, which is a thiamine derivative. It's a fat-soluble form of thiamine that allows the mitochondria to function more efficiently. So then you can actually make more energy. You won't fatigue as easily. And the nerves work better because they're getting more energy. The system, the function of the body is all about energy. If you get rid of energy, that's like, cutting off your oxygen supply, you die. Why? Just because you don't have any energy. So that is really the essence of why Nervala is important, is you start getting energy production. And that's why people who have neuropathy, the nerves are dying from lack of energy. And when you add in the Nervala, the alpha lipoic acid, and benfotiamine, the nerves can start making energy again. And so they wake up and they go, oh, I can work again. So then they function.
Excellent. Okay. Say, I don't see Skip quite on video here yet, so I don't know if they're working on that. But in the meantime, we had a question come in from Krish, and actually looks like Skip might be. Oh, there's Skip. Okay, so Skip, if you're able to join on video.
There we go.
Hey, there we go. All right.
There we go.
There he is. Hey, good to see you.
There I am. Well, pleasure to be back on. This is great. I like the idea of this Nervala. I have small amount of neuropathy on my toes on my right foot, and I'd like try the bottle of that to see whether or not, you know, that's going to do some good for me. And I got into ketonics on this back before I discovered your site, but I've been a faithful watcher ever since. And I'll start buying some more products as we go along.
Well, thanks, Skip. Yeah, it's been great to see you on our calls every week here. So, and it's nice to finally put a face to your name and your voice. So I think last time we had you just on our phone, we were in Utah and we couldn't get the video to work. But so great to see you. Looking good.
I feel good. I was amazed that it takes so long to get back to ketosis after Thanksgiving. It takes 3 or 4 or 5 days.
Yeah.
Before that, your system works out all the sugars and stuff.
Yep, that's right.
It's starting to come back.
Good. Yeah, back to how many carbs are you typically eating in a day?
Well, the only carbs I eat are a casserole in the morning for breakfast, which is basically eggs. It has some half and half and cheese in it and some ham. And that is the carbs I take in the morning, a small slice of that. And at lunch, I have protein and protein for dinner then. You know, I eat vegetables and meat. And if I eat too much meat, sometimes my body gets anxious about sugar and makes some more in the middle of the night. Or if I don't get a good night's sleep, I wake up with the same blood sugar in the morning as I went to bed with. So it's something you got to watch.
Well, I think that Nervala is really going to help you sleeping. It helps me a lot because I sometimes will wake up at 2 or 3 in the morning, kind of like restless. And but if I have a Nervala before bed, like I sleep through the night and sleep great. So, and I don't have diabetes or anything, but I mean, I might be pre-diabetic technically, but kind of, yeah. So I think you'll find some good help with that, and also with the neuropathy in your feet. So for sure, that's like one of the main benefits of how it works. So
yeah, I'm not into measuring precisely my food intake, but I measure the ketones that I get out of it. And they're usually in the moderate range.
Okay, and is that the urine strips for ketone?
Yeah, urine strips, not every day, but once a week or so.
Sure. And you mentioned that casserole you have for breakfast. The ingredients you listed off are mostly, there's not a whole lot of carbs in that either. So I think that's helping you keeping your carbs really low.
But doesn't half and half milk have some sucrose in it?
It's pretty low. Like half and half is pretty low sugar, isn't it, Scott?
Well, it has some lactose in it, but it's not a lot of sugar. Yeah, I couldn't tell you the numbers of it, but no, it's not high in sugar.
Yeah, and you could even use whipping cream, which would be even lower. Typically, it's higher fat. So, well, did you have any
whipping cream with a casserole? I'm not sure about that.
Oh yeah, why not? I put it in my coffee, but
oh well, I'm afraid I'm not a coffee drinker.
Oh yeah, okay. So, did you have any questions you wanted to ask, Dr.
Yeah, I did. The neuropathy that I get in my toes, I've had for about 5 or 6 years, and I get my right arm stays cold. My hand is always cold, it seems like. And I assume that it has to do with neuropathy. Is that a case, or is it because of my stroke? I can't be sure. But
okay. I'm sorry. Did you have a stroke that affected your right side?
Yes.
Okay.
I did.
Yeah. Yeah. So the problem is, yes, partly the nerves, but it's the circulation. So the issue is not just that the nerves aren't working very well. It's that you don't have really good circulation on in that arm, and
The
that could be because of the stroke.
stroke I had is a pontine stroke, and it's fairly unusual. About 70% of the people that have a pontine stroke die, and it's a stroke of the pons.
Yeah, actually, right. The stroke in the pons, that's where the connection for the control of all your muscles goes through there. And
Yeah.
having a pontine stroke can be disastrous. I had somebody who had one who got what's called locked-in syndrome, where
Oh,
she
that's a
could,
bad one.
yeah, she could only blink her eyes. She couldn't move a muscle in her body. It was
Yeah.
only blinking her eyes. And
I'm
so, yeah,
going up to a neuropsychologist today to get evaluated and see if there's some sort of rehabilitation that could perhaps be made with this. I know there's not much, but I'm going to work on it.
yeah, there is. If you work on it with physical therapy, and and then the Nervala should help the nerves come back. And part of the physical therapy is your autonomic or sympathetic nervous system, and that's what controls the blood flow. And after a
Uh,
pontine stroke, you can get a sympathetic dystrophy, it's called, and the physical therapist should be able to help you with that too.
Well, I've gone to them for five different times. Also noticed that right after my stroke, about 3 months later, I was taking insulin at the time, and suddenly my body had lost weight, and I stopped needing insulin at all for about 6 months. And I wondered if this was right after the stroke. I wonder if it infected my upper gut and stomach, and how the connection between my stomach and diabetes works.
Well, that's really interesting because there have been rat studies um, on the connection from the brain to the stomach or to the pancreas. And when they take certain types of rats that have a predisposition to diabetes, and they cut off that nerve, called the vagus nerve that connects the brain to the stomach and intestines and pancreas, then the pancreas starts working again, and their diabetes goes away like instantly, like it's gone, when they cut off that connection. So it sounds like you've had some sympathetic nervous system part disconnected, which allowed your pancreas to start working again.
That was
And there's research to show that happens.
part of that was the reason why I decided a year or two later to take control of my diet and the ketogenic diet to cure my diabetes altogether, because I knew it was possible.
Good for you. Good work.
Yep. You know, all things in life come to you sometime.
Mm-hmm.
That's right.
Yeah. I'll get you on my prayer list, Skip. I hope that meeting goes well, and I hope you're able to, get back to 100% health.
Well, you know, I'll take what I can get and be happy for it. You know what? That's all that life. Life gives you what it can, and you just make the best of it.
Yeah.
And
That's right.
it's the attitude I have to take.
Yeah, that's great. Well, attitude is so important, having a positive attitude and being thankful. We just, went through Thanksgiving here, and it's a great reminder to have an attitude of gratitude, an attitude of Thanksgiving, and to even when bad things happen, realizing that those things are for our good. We can persevere through them and see the lesson to be learned or the growth that we can have in that. So I'm sure even like your stroke, like you probably experienced some new opportunities there and new challenges that ultimately
challenges, especially.
Yeah, right.
It's I don't walk anymore. I have a controlled stagger.
Oh yeah.
But I can still do everything. I still work full time. I drive and, you know, I get around, but it's a challenge. There's no
Yeah.
question about it.
Mm-hmm. Yeah. Well, good. Well, great to see you, Skip. Thanks again for joining us. And
All right.
we're going to be,
Appreciate it a bunch.
yeah, thank you. Okay. So, so did you want 2 bottles of Nervala or 1 bottle of Nervala and 1 of Synachroma or?
Yeah, one of each would be good to
Okay.
try.
Got it. Okay. We'll send those out to you. All right.
And if she'll ask, well, let me text Pam my address.
Okay. Yeah. And that'll be Leslie, actually, that'll take that from you. So, all right. Well, thanks, Skip. Okay. So I wanted to get to a question that was typed in here from Krish. Hopefully he's still on here. And Krish, if you're available to hop on video quick, you could ask this in person, but otherwise I will read this. So Krish asks, he says, I'm a type 2 diabetic and my recent A1C is 6.7 and I'm a senior citizen. I've been on metformin XR 500 milligrams in the morning and 500 milligrams after dinner. I also take other supplements and herbs we know which reduce sugar levels. These are cinnamon, cumin, okra, and milk thistle, but I think I'm consuming too much metformin. I don't feel hungry, and I feel weak and tired easily. Do you have any comments on this? And let's see. He's actually taking 2 500 milligram tablets and 2 500 at the night and at night as well. So.
Okay, so that brings up a really important thing that happens with the use of metformin, and that is metformin blocks the ability of the mitochondria to make energy from sugar. And so if you're taking a small amount, then you get a little bit of blocking of that, which increases the body's necessity of using fat for energy. However, if you have high insulin, then that blocks you from using fat for energy. So now you have 2 problems, and that is you can't use sugar and you can't use fat. And so your body can use protein to some extent. So some people with the metformin get easy fatiguing. And that's kind of important because if you push through that and do too much, you could get your muscles could start breaking down because they're just not getting enough energy, and so they can't regenerate, they can't relax. You could get cramps. So some people get what's called rhabdomyolysis, which is the breaking down of the muscles from taking metformin. So yes, that's a possibility that you could get easy fatiguing from metformin, and you could be taking too much. Your hemoglobin A1C at 6.7 is still in the diabetic range. So your best bet is to just try to start burning fat and get your insulin down. So doing a very low carbohydrate diet, like in the diabetes reversal program, that kind of thing. Also, intermittent fasting helps. If you do what we've discussed in the previous ones, are a 6 and 10 program. You stop eating after 6 and go to bed by 10 with an empty stomach. That helps you be more sensitive to your insulin so that you can start burning fat. And those would be good ways to do that. And then work with your doctor on, you could just try a trial without the metformin, and most doctors are willing to help you with that, and follow your blood sugar, follow your fatiguing or your energy levels, and see how you do.
Great. Awesome. All right. Hey, Leslie, if you are up to the task, I would love to have you hop on quick and just tell people how they can join us as far as our Facebook page specifically, if they're not already active in that. Pam mentioned that. So if you could maybe just hop on quick and say hello, and I'll put you on the spot here. So.
Okay, let's see here. Get my video on.
Loading. There we go.
Hi. Okay, so you want to know how people can join our Facebook group, correct?
Yeah.
Okay, well, first of all, make sure that you've joined or liked the Barton Publishing Facebook page, because that's where you're going to find a lot of the information that comes across. I even repost how to register for these webinars, any of the Facebook live streaming that we do is there as well. So first of all, make sure you like that. And you know what? And actually, I'll post it in the comments here when I'm done talking. The other thing, I think I may even just post a link to maybe the 610 group right now. Would that be an option, Joe?
Yeah, let's do it.
Okay, so it's still in the works, but you can join us. So I got to find that and I will post it.
Okay, great. And we can put that up on bartonwebinar.com. That's kind of our main hub site.
Yes, that's true. Okay, let's do that.
So, yep, we'll talk to Eric and have him put a link on there if it's not already. So, yeah, bartonwebinar.com is a good place. And then YouTube is linked from that as well. You can subscribe. You can watch all of our previous webinars that we've recorded. A lot of great information that we've covered here with Dr. Saunders, talking about more in depth about metformin and other medications, intermittent fasting, specific supplements, foods, different things like that. So a lot of great information there on our YouTube channel. Like us, subscribe, all that good stuff. Click the bell so you can be notified if you're not able to join us live. And yeah, every week, Tuesday mornings at 10 a.m. Central typically is when we do this. And we are also active in Facebook, posting different things, and would love to hear from you with suggestions, comments, topics that you'd like us to cover, anything related to diabetes. And thanks everybody for joining us. Scott, I always like to ask if you've got any jokes queued up here at the end here, just to kind of end with a laugh. So if you've got one, we're ready for you.
Parallel lines are so similar. It's really a shame that they're never going to meet.
It is. But that's good. That's good. All right. Well, thanks everybody. Great to see you all on the call today. Hope you have a great day, a blessed day. Don't let the cold weather get you down. You can still go out and make snow angels or go for a walk, or I guess if you don't have snow, you can just get outside, get some exercise. And Pam, I got your note there. I will send you a bottle of turmeric and Nervala. So thanks for joining us, Pam and Skip. Great to see you today. And great to have you. Appreciate your feedback. Glad that these webinars are helping. And Scott, again, thanks as always for joining us and for providing so much good information and helping keep people on track.